Welcome to the Cornell Cooperative Extension Dairy Herd Health Troubleshooting Podcast, a podcast series focused on how to go about looking into health issues on a dairy. Each episode will discuss a different area on the dairy where herd health can be impacted. This series has less to do with providing answers to problems. We'll be talking about how to be more successful in your investigations.
Welcome to another episode of our Troubleshooting Herd Health Issues podcast. My name is Havekes. I am one of the dairy management specialists on Cornell Cooperative Extension North Country Regional Ag Team. And today I'm joined by Margaret Quaassdorff, who is also a dairy specialist on the Northwest Dairy Livestock and Field Crops program. On today's episode, we are going to discuss challenges during calving. So from the time the cow starts calving until the calf is born, this episode is going to explain what to do when everything goes wrong and what you can do as a producer to evaluate the situation and know when to help your cows and calves. So why don't we get started, Margaret, and why don't you kick it off by talking about signs of calving and what happens when the cow starts to calve?
Sure. So we hope for a smooth birthing process from our cows, but a lot can go wrong, which causes headaches for us and poor health and milk starts in our fresh cows. The first step in helping things run smoothly is to know and identify the signs of calving and to only assist when absolutely necessary, and of course, knowing when that is. So what are the signs of calving and how do we know when we need to help? First, we're going to look for behavior changes in the cow. Normal signs that a cow will calve soon are the cow is looking uncomfortable. She might be getting up and laying down a lot. She'll be standing with her tail raised up. She might be pawing at or licking the straw or the bedding. You'll see her tail head ligaments will be relaxed and her udder will be bagged up or filled with colostrum. You might see the vulva have some swelling in it, and several hours before calving, you might see a mucus plug being released from the cervix, which just looks like one gob of mucus hanging out. 1 to 3 hours prior, you might also see the water bag or the feet visible. The cow will begin straining or pushing, having her first contractions, and she might be making some vocalizations, some moaning sounds. These are all normal signs of calving. In order to help you troubleshoot what might go wrong, it's important to write down the cow's ID number and what times you're noting these normal signs of calving so that you can accurately tell when things are not normal.
So, Margaret, at what point should a producer intervene with the calving process?
Yeah, if no feet are visible 2 hours after the bag has appeared, or if you see feet but there has been no progress after about an hour, time to grab a clean glove and check. Try to secure the cow in a calving pen headlock that's also against the gate so that she can't swing her hind end around and injure your arm. Make sure you take off any jewelry from your wrists or hands and wash your hands and arms before putting on the glove to maintain cleanliness in case the glove breaks. You also don't want any jewelry to injure the inside of the cow. Use lubrication on the glove before inserting your hand slowly into the birth canal. What you're feeling for is if the calf is in the correct position to come through the birth canal. I like to think about it as the Superman flying pose. You want the calf to be right side up with both front feet forward, with its head and nose between those both front feet and its back legs behind it. If you reach in and you find only a head, but no front feet, or maybe only one front foot, you might be able to push the calf gently back into the uterus to gently manipulate the head and legs into the correct position. Make sure you're taking care not to exert too much force as to break through the fragile uterine wall when you do this. If you have two back feet facing the correct way, that is in the breeched position, but the calf is backwards, it's important to get that calf out quickly as there's an increased risk of the umbilical cord being severed, and that means that the calf won't be able to get any oxygen. If you end up having just a tail when you reach in, or if the calf is twisted upside down, it's definitely time to call for assistance, either an experienced trained employee or in more severe cases, a veterinarian, especially if you're not properly trained to reposition the calf yourself or you're inexperienced in doing so. In addition, if you can't feel past the cervix when you reach in, that could mean that the cow is either not properly dilated or the uterus is twisted and Therefore, it can't contract properly, and the birth canal will never be large enough to allow that calf to pass. So this is also a time that you would call a vet to help you get this calf out. If the birth canal is too narrow, sometimes this can happen with our virgin heifers, or if a cow is overconditioned, it can feel like the birth canal is too narrow. Or if you have 3 feet showing, or you suspect that you have feet presenting from more than one calf, it's also time to ask for help. It's also okay to ask for help if you feel something strange, or if you're unsure of the position of the calf. Remember, you're going in blind. You just have to feel around. So sometimes it can be difficult to determine what position the calf is in. If you have worked for 10 minutes without success in repositioning the calf or understanding what's going on, that's another time to ask for help. Okay, the clock is ticking, but it's really important not to try to pull the calf until it is in the correct position. It's possible to get the calf even more stuck and therefore risk both the cow and calf if you pull without confirming proper positioning. Also, you might notice a bad smell from the birthing fluids. If you do smell that, there's a good chance that the calf is already dead and that the cow will need extra help expelling the dead calf. All of this seems a little bit complicated, and when you're going in blind and just feeling around, it might seem impossible to know whether or not a calf is in the right position. But all of it takes practice. It's better to ask for help when you're learning than to go ahead unsure, as inappropriately timed assistance can damage the birth canal and can have increased risks of developing metritis and other post-calving issues. At this point, if we're having a rough time, we already know it's going to be a hard calving, and this is likely going to be a dystocia calf. Casey, can you tell us about the negative effect of a hard delivery on the calf and what we are looking out for from the calf's perspective?
Yeah, definitely. So calves that are born to difficult calvings are commonly called dystocia calves. And by definition, dystocia is defined as a calving difficulty requiring assistance. So it's actually pretty common. According to data from 2008, the incidence of severe dystocia in dairy cattle ranges from 2% to 22%, while the proportion of assisted calvings is higher and ranges from 10% to 50%. So we know that dystocia can have potential long-term effects on the calf, and research has actually shown that these calves may have reduced survival rates and actually produce less milk once they're an adult. So this is a really important time for the calf that we really need to consider and make sure that we optimize her success. So Margaret, you briefly mentioned this, but one of the important things to remember when it comes to calving is that when the calf's umbilicus is disconnected from its mom, it no longer can get oxygen from its mom. So it has to breathe in air in order to survive. So when cows have difficulty calving and the calf doesn't have access to oxygen, it can lead to a state of respiratory acidosis. When respiratory acidosis is prolonged and not corrected, it can lead to a state called metabolic acidosis. And this essentially causes the calf's blood pH to drop, and it's going to cause many other issues. One of these issues is that it's going to decrease colostrum intake and IgG absorption. In some research, it was actually shown that acidotic calves had a 52% decrease in colostrum intake and a 35% decrease in IgG concentrations compared to non-acidotic calves. And part of this is due to decreased absorptive ability for those calves. But the other part that's equally important to consider is behavioral, and it's related to the fact that dystocia calves are weaker, they take longer to stand, and they may have a poor supple reflex.
So Casey, what can we do to care for these calves?
So we can do a lot for dystocia calves that's going to help pull them through, but I'm just going to briefly touch on 6 important strategies that should be implemented when you have a dystocia calf. So the very first thing that you should do is sit the calf upright in a position called sternal recumbency. So essentially, if you can visualize it, the calf is sitting upright with her legs underneath her. And we'll attach a photo of this in the episode notes. But basically, this position will allow her lungs to expand, and hopefully this will get her breathing. The second step is to stimulate respiration and get her breathing if she's not already. So once oxygen starts entering the lungs and carbon dioxide starts leaving, then the state of acidosis is going to begin to correct itself. And hopefully by sitting her upright, you've started this process of breathing. But if she needs more assistance, you can tickle the inside of her nose with a piece of straw or pour cold water over her head, which is going to trigger a gasp reflex. And that will also help her to start breathing. You can also somewhat aggressively rub the calf with a towel to try to get her breathing. And at the same time, this is going to help her warm up. But one very important takeaway that I can't stress enough from this episode is that you should never hang the calf upside down or swing her to try to get fluid out of her lungs. It's just going to do more harm than good, so please don't do that. Okay, so the next tip is to get her warm. So in order to stay warm, calves break down brown fat and engage in physical activity, both of which are compromised for dystocia calves. So you could use a heat lamp and make sure that you have dry bedding. That's going to go a long way. And then, as I just mentioned, use a towel or a calf jacket to try to keep her warm. The next thing to do is to expand her blood volume. And the easiest way to do this is to get colostrum into her. And not only is it going to expand her blood volume, but it's also going to help correct the acidosis. So I just mentioned how dystocia calves lack a suckle reflex, and they're sometimes called dummy calves because of this. And combined, this can increase the risk of her having poor IgG absorption. So this makes colostrum delivery very, very important. So you want to make sure that she's getting the best quality colostrum that's possible. And if she doesn't want to drink, tube her. There's actually been research that has shown that IgG absorption is not different for tube versus bottle-fed calves. So in a situation where she won't suck, you really, really have to make sure she's getting that colostrum into her and make sure that you're properly trained on tubing, and then don't hesitate to tube feed that calf. Also pay attention to how the colostrum is being warmed, especially if you're feeding frozen colostrum. So you want to make sure that it's being warmed slowly, and I know that it's going to take some careful planning and time on your part. So it's kind of a double-edged sword. We tell you that we want to get the colostrum into the calf as quickly as possible, but it also takes forever to properly warm it. But it's really important to remember that if you just throw it in boiling hot water, the proteins will be denatured and it's essentially pointless. So the water that you're warming the colostrum in, you want to make sure that it's comfortable for you to put your hand in and that it's not too hot. Okay, so the next strategy can be useful for extreme dystocia cases, and it's going to require planning with your vet. But you could consider giving her a non-steroid anti-inflammatory drug, such as Banamine, and this can help pull her through. Again, this is going to take some consideration, and I highly recommend talking it over with your vet if it's a strategy that you're going to implement, especially because you're going to have a vet sign off on it. And lastly, just monitor her extra closely. She's going to be more susceptible to disease, especially if she has compromised passive transfer. So just keeping an extra eye on her can really go a long way. You're going to want to watch out for behavioral indicators of disease, as those are often going to present themselves sooner than physiological signs. And then just make sure you're intervening as early as you can if that calf does get sick. So I kind of raced through those tips, but all of these are going to be covered in more depth during our upcoming Critical Calf Care series. We have a full episode dedicated to dystocia. So we'll go ahead and put that info in the episode notes, and then you can check it out if you want to learn more. So Margaret, let's get back to the cow. We've taken care of the calf, but we can't forget that this cow just had a very difficult calving. Is there anything else that a producer can do for her, or is there anything else that they should be looking out for?
Yeah, so oftentimes after a difficult calving, the cow can experience a number of challenges. She might still be laying down, and that's okay. She's exhausted. Give her a few minutes to recover, but it is important that she does get up soon after calving. If she can't stand up after 15 minutes or so, or is shaky with knuckled over rear feet, you might be dealing with some pinched nerves. Ask your vet about proper treatment, which usually includes some sort of dexamethasone course of treatment. If after a rough calving you notice that your cow continues to push and ends up with a uterine prolapse, this is an emergency. Call your vet immediately, as these are difficult to fix and the cow can easily rupture a blood vessel and bleed out. Right away, or when she's able to drink, make sure you give your cow plenty of fresh, warm water. The birthing process can be lengthy. She's been at it for a couple hours. Most likely she hadn't been drinking anything during that time. And there's a large loss of bodily fluids during calving that need to be replenished. Adding an electrolyte or energy powder to the water may also aid in her recovery. When it comes to calving, cows go through a substantial amount of metabolic and physical changes that often result in temporary inflammation. As the body begins the healing process postpartum, inflammation can be painful, and prolonged inflammation can have lasting negative effects on the cow. To help fresh cows move on to feeling their best more quickly, some farms give aspirin boluses after calving. A recent study out of Penn State looked at the effectiveness and feasibility of treating fresh cows with 2 doses of aspirin, one within the first 12 hours after calving and again 24 hours later. It was found that compared to untreated cows that received aspirin had lower metabolic stress 2 weeks after calving and a lower incidence of metritis, which is a uterine infection, later on. Furthermore, those mature cows that received aspirin produced 3.6 pounds more milk per day in the first 60 days than their counterparts. These are all great things to do to help your fresh cow that has been through a tough calving. And of course, getting her to fresh feed as soon as possible will do her a lot of good as well.
So Margaret, when a cow has a difficult calving, how long should we wait before we move her out of the calving pen?
This is going to depend on farm protocols and farm setup. Some calving pens are equipped with feed and water and a quiet, comfortable place to recover. Other pens are just meant for the calving event only, and it might be better to move the cow out to another pen. After a hard calving, it might be better to allow the cow to get her feet under her and to feed the calf a thawed colostrum from another cow. You wouldn't want to take a shaky cow to the parlor and risk her going down on the way or even in the parlor for that matter. So if your farm has a portable milking system and you can milk the cow right there in the maternity pen, that may be an advantage when dealing with higher risk cows in order to prevent any injury to the cow.
Thanks, Margaret. Those are all really great points. So we just gave our listeners a ton of information. So maybe it would be a good idea for us to summarize by giving them 3 take-home messages, both from the cow perspective and the calf perspective. So why don't you go ahead and start us off with the cow perspective?
Sure. My conclusions are pretty simple. Learn to recognize the signs of labor and know when to jump in to assist or call for help. Also, postpartum care is important after a hard calving, and when cared for properly, these cows can still enter their lactation successfully. What about the calves?
So the first point I'll make is to recognize dystocia. Try to recognize what it looks like, how it presents itself, and then look at how it's going to impact the calf. So we didn't go over it in this episode, but we will go over it in great detail during our critical calf care webinar. And we're going to talk about bigger scoring dystocia calves in that episode. And that can really help you understand just how severe the dystocia is. And that's going to help gauge your efforts with that calf. The second point I'll make is to pay careful attention to how we should care for those dystocia calves. So again, our critical calf care webinar that is launching on January 5th will go through some of those really critical points for dystocia calves, but just making sure that you're doing everything you can to get them breathing on their own, get the colostrum in them, keep them warm, and then just careful monitoring of them as they go through their pre-weaned phase of life. And then lastly, understand the risk factors and actively try to minimize them. So there are a lot of risk factors that are out of your control, but just pay attention to proper sire and dam selection and making sure that you're intervening when appropriate, as Margaret's described.
Thank you for tuning in to this episode of Troubleshooting Herd Health Issues. And please join Casey and I next week as we discuss transition cow metabolic disorders post-calving.
Thanks for listening to this Herd Health Troubleshooting episode. You can find more episodes like this one on the CCE Dairy Educator channel on SoundCloud or on the ProDairy website, along with many other resources.